Hello and welcome to the Express on Purpose podcast. I'm joined today by Dr. Andreas Stridsland. Welcome to the show.
Thanks for having me.
Nice, pleasure to have you here. As I said, we're going to start by a few grounding breaths just to help us connect in to our bodies and into this conversation. So we'll just close our eyes and we'll just settle into our bodies, and then I'll guide us through 3 breaths. So we'll just breathe in deep through the nose, filling up your belly. Let out the sigh. Second breath, breathing in through your nose. And let it out. Feeling your body soften. The last one, deep cleansing breath, breathing in. Breathing out. Slowly opening your eyes, coming back in together. I always feel a lot more at peace after that. After just 3 breaths is all it takes just to kind of settle the body. You obviously have a wealth of wisdom being a chiropractor and all of the many degrees and experiences you have in your training. I'd love to kind of just set a bit of the scene about what inspired your journey into being a chiropractor and a bit of a flavor of the type of work that you do with people.
Yeah, so I guess where does it start? Growing up, I've always been the kind of guy who likes to tinker with my hands. My brothers and I, we did a lot of bike riding when we grew up, so we would tinker with our bikes and just kind of understand it, get to know it. And then my dad, especially, he's a very handy kind of guy, and he's done a lot of like home building, and he's just he works really well with his hands. And so that was always kind of a bit of a role model for me. Fast forward to, I guess when I was going through these little growth spurts, I'd have some aches and pains here and there. My parents would take me to see a chiropractor, and that always felt pretty good. Interestingly, at the time, I never really thought much of it. I wasn't like, oh, I want to be a chiropractor. He saved my life. It was just it was just a good overall experience. Then coming into the time where I was kind of like, okay, like what do I really want to do with myself? And it just kind of landed on me that chiropractic was an option. I knew I wanted to do something in the healthcare scene. If it was like medical doctor or physio or massage or chiro, I wasn't really 100% sure. But after just kind of like sitting with it and thinking about it, chiropractic it sounded right. And so that kind of started the journey of like shadowing different people, different providers. And then I really understood like, oh yeah, chiropractic is actually pretty sweet. Yeah. And so then that's kind of what drove me into chiropractic to start with. I do have some extra education in the neurology field. And so pretty much after graduating, I was in practice for a couple of years in kind of general practice, and I had this handful of patients that were able to get like 95% better, and these are all car accidents or sports concussion injuries. But the last little 5 to 10%, I was like, I'm not really sure. And so I reached out to a couple different people, and I found this guy who practices this clinical neuroscience, or in the States it's called functional neurology. And I sat down with him a couple times and just asked him questions, and eventually I sent those patients to him, and within just a handful of visits, he got them all better. And I was like, what's going on?
Nice.
Like, how can you do that? And so that's kind of what really spurred me into this more specific kind of neurology side of things that I'm doing.
Nice, cool. Yeah, it gets me curious, and I guess that's the curiosity of what have you uncovered as that 5 to 10% within the neurology side of things?
Yeah, so it's pretty funny. I visualize it as like, the last kind of like 5-10% is just this little kind of like one last little door that opens up, and then you can just kind of walk through. But it's actually like you go in and it's this like vast maze of stuff, and you're pretty much just like opening the door into the brain and trying to understand what's going on there. But really it comes down to kind of understanding the foundations of your senses. We understand it as kind of 5 main senses. There's sight, sound, touch, smell, taste. That's kind of like the traditional senses. I would venture to say there's more than that. For example, proprioception. You can I guess you can go a deeper dive in through touch, and that would be more proprioception, which is more your joint position sense from the body. So how well do you feel what your body is doing at that moment in time? And how well can you coordinate that? Then there's also, I would consider vestibular sense, your inner ear, as another one of your senses. And that's essentially where your balance and your equilibrium stems from. It's there to detect motion of your head, and then it sends appropriate signals down to the rest of your body and the rest into the brain to say, we're moving, this is how we're supposed to react to motion. Yeah.
So you would say there was seven major senses?
I would say there are seven major senses, maybe even 8. That's 8. The 8th one I would say is more like interoception. But you can maybe tie that in with proprioception as well, because it's not just your joint position sense, it's the sense of yourself, including the insides. Yeah.
Yeah, that's a great distinction. It's kind of why I say with my clients, for me anyway, maybe I've misunderstood it, but proprioception is this sense of where you are in relation to a space. And so it's kind of that relational perception.
Yeah.
And then this interoception is your awareness of what's happening inside of you. So there is that felt sense on the surface of the heat, of the pressure. Then inside, can I sense into how is my diaphragm feeling, or where is there tension in my chest? And it's kind of verging on an emotional sense to a degree, because you're feeling into the feeling state that can then take you into the emotional aspect.
Very much. Very much.
How aware do you find your clients are of those extra 3 senses when they come in to see you, or even when they leave to see you?
Yeah, so I would say when they come in, they're not very good. And when they leave, the goal is obviously to have them be as good as they can be, as optimal as they can be. Some people, it does require some additional support from the outside, like not just me and my treatments. They would need some additional support, either if it's through counseling or breath work or meditation, or it could also be more like physical, like some nutritional support, that kind of stuff. But I would say for the most part, when people come to see me, things are not lining up appropriately. So those are kind of, I guess, the 4 main systems that I look at. That would be your vision, proprioception, and your vestibular sense. And then the last one is your autonomic nervous system. And that's the fight or flight, the rest and digest branches, or sympathetic and parasympathetic branches. So yeah, because most of the patients that I see, they are very chronic in their conditions. I would say on average, I'm seeing patients who are at least 2 to 5 years out from their initial accident. They may have accumulated more concussions on top of that, but for the most part, I see more of the chronic conditions. And so when you get that initial impact, your brain essentially changes. And just like you can change for the better, you can also change for the worse. So that's the neuroplasticity, the capacity to change things, change connections in your brain. Your brain doesn't recognize if it's a good change or a bad change. It just knows, hey, this is what we're doing most often. Let's make it most effective or most efficient. And so again, it doesn't recognize, oh, that's a bad neuroplastic change. It just recognizes, hey, let's make this best. So yes, I'd say people who walk in initially, they're not doing so great.
Right. Yeah. So they're kind of misaligned. And I've got a few questions off the back of all of that. So one, as a chiropractor, how are you reading into that sense of how the autonomic nervous system is kind of positioned on that spectrum of hyperarousal, or kind of in a
yeah. So I feel like I look at it through a little more of an objective lens. So I just like understanding their history. So for example, someone with an autonomic condition, classically they will have a hard time with transitional movements. So that means like lying to seated or seated to standing. They'll feel lightheaded, or they'll feel heart palpitations, or they'll feel anxious. But autonomic disorders can also show up as changes in their sweating patterns. Like some people, for some reason, they sweat on one side of their body 100% more than the other side, even though they may still be sweating on both sides, but one side is oh yeah, my armpit stain on one side is noticeably bigger than the other side always. Or their digestion might be all wonky. They might have they may have been diagnosed with IBS, for example. They can also have these pain conditions, fibromyalgia, polymyalgia rheumatica, that kind of a presentation. a lot of temperature dysregulation, but also anxiety and a lot of emotional dysregulation goes along with these autonomic conditions. So that's kind of just like the history component, is just like listening to what they say,
right,
and me asking questions. And then when it comes to actually like testing things, I'm testing their blood pressure, I'm checking their heart rate, I'm checking their oxygen saturation, because that's an automatic function. It's running in the background. You're not consciously thinking, okay, heart, beat, pressure, maintain. And so I'm putting them through different challenges, and then I'm monitoring and checking those pupillary light reflexes, another really important one. I'm sure as you've seen either in your clients or just in yourself, if you get startled or if you're kind of like super aroused, your pupils get really big. That's more of a sympathetic response. Whereas if you're just like super chill and you just had a big meal and you're ready to fall asleep, pupils tend to get smaller and smaller and smaller. And so that kind of relationship and how they react to light is also a really good indicator for the state of the autonomic nervous system at that time.
Right, nice. Yeah, curiously for me, a lot of my clients are eyes closed, so I don't actually see the
pupils,
right,
of course.
From a focus narrowing or widening perspective, it makes sense in terms of when you're needing to take in a lot of visual stimulus. The pupils dilate, and then you can kind of take in all the light, and that's sympathetic state. And then when they constrict, you don't need to take as much in, and so they can constrict and reduce the intake.
Yeah,
so
exactly.
That's all curious there. And from a testing of the spine perspective, there's many different kind of methods within the chiropractor world. What's the specific name for the type of chiropractic that you do, and how does that correspond in these other?
Yeah, totally. So I would classify myself that I do clinical neuroscience.
Okay.
And chiropractic is an additional part of that.
Okay.
In that I can do these spinal manipulations or extremity manipulations to essentially I use the body as a conduit to influence the brain. So the adjustments that I do are very brain based. That's at least how I look at it. Depending on what kind of chiropractor you talk to, they may say, oh, it's a subluxation that you're correcting, or it's a joint restriction that you're correcting. To me, that's semantics. We are all ending up with the same result. The same kind of goal is to improve the function of the brain, and by default then the spine and the body.
That's interesting. And so then to a degree, that final 5 to 10%, are you actually flipping it on its head now and kind of starting with that 5 or 10% and seeing the effects?
Yes.
Trickle down?
Yeah, and so the reason I've now swapped like that is the way I understand things, if your perception of reality is not accurate to reality, you're going to be compensating to try to react accordingly. So for example, if this is an extreme case, if you perceive that gravity is not straight up and down, it's actually tilted like this, you're going to be walking around tilted like this as well, right? Because this is what you feel straight up and down is. That's an extreme example. Another example would be someone who feels like their arm is here, but in actual fact, it's right here. That little change in this perception is going to cause them to they're always knocking something over on the table, or they're always fumbling with their keys, or they can't coordinate movements smoothly. And that's when you start to see tremors, or you start to see some instability while they're walking, or they can also create a lot of visual disturbances and headaches and just a whole host of symptoms.
Okay, right, nice, interesting. And so then by recalibrating or kind of retuning the brain's awareness of these bodily functions, it kind of brings it back into alignment with the homeostasis or natural way of being. Exactly.
So then what I see is once we've kind of corrected for any visual, vestibular, or proprioception dysfunction, then anything residual that's happening in the spine is very easy to work with, very easy to resolve, because then it's purely more of a biomechanical thing as opposed to this neurological influence over the back pain that they're experiencing, or the neck pain, or the knee pain.
Right, yeah, fascinating. Yeah, I kind of see it as building something on sand versus building it on concrete. If you're on sand and it's shifted out of direction, you need to go and then kind of realign it all so you can build the scaffolding on top of it, rather than trying to fix the wonky scaffolding and have the sand continually move.
Exactly.
And when you're kind of working with somebody in terms of this kind of inner perception of the world, and inner perception potentially of what might have been a traumatic event, how much of that becomes this kind of emotional or kind of therapeutic component that's required outside of the 3 senses you've mentioned there as well?
Yeah, it's very, very important. The body stores trauma, right? And so in order to work through that, there needs to be an emotional or a cognitive component to it. So of all my patients that I see, I really try to have them, if they're open to it at least, support through a counselor, a psychologist, or it can also be someone else like a breath worker or a somatic experience provider or like a trauma-informed practitioner, because it is really important to have to work through that limbic response. Many, many times I see with my patients certain stimuli or certain triggers will evoke this emotional response, and to me what that says is there's very clearly this emotional link to whatever that stimulus is. And sure, we can work through some light sensitivity and some sound sensitivity, but if there's still that emotional link to it, that's going to be really, really hard to rewrite without any sort of cognitive or emotional support.
So if the mind is kind of primed for reaction to a certain stimulus, then it's going to react fast and quickly with the limbic system to respond to that, to keep you safe.
Yeah.
And so then, having to address that is kind of pretty foundational to the change and working through these kind of states you get yourself into. And so when you see someone with kind of post-concussion symptoms, they're feeling dizzy still, it's been a long period of time, they come to you and then you kind of assess them on these areas, and then you give them some exercises to work on in their own time and with you to help them kind of retune, and then also alongside that kind of work with a therapist or a counselor to try to work on the emotional component. Are there any other aspects to the healing kind of journey you take them on that have kind of missed there or that you work through?
No, that sounds pretty good. I would say there is maybe one more part, and that's definitely more of a nutritional or a metabolic aspect of it. And so in order for your neurons or your brain cells to be functioning appropriately, you need certain ratios of substrates. So for example, you need a good protein intake, you need good fat intake, you need appropriate electrolyte balance, and that kind of nutritional support I typically refer out to a naturopath. In my experience, they're much more nuanced when it comes to your blood work results or certain symptom profiles. They can understand that just a little better, as opposed to saying, oh, you fall within range, things are normal, but clearly something is off. So I find that a naturopath typically is a little better at understanding that.
Nice, yeah. It also seems like for a lot of people, the kind of physical or traditional massage or physio or chiropractor become this kind of gateway facilitator or gateway practitioner into like, oh, you're actually opening a door of healing here, and you're going to go to a therapist, go to a naturopath, go to all these different specialists to start to actually have the lasting foundational change that you're looking for.
Yeah.
Which I know we've kind of talked about this before, of this kind of curiosity from a less scientific, more spiritual perspective of how, I guess for myself and for maybe a lot of people, there's these kind of big events that happen that create a concussion that to a degree kind of not knock your senses awry, but help you to get clarity on, oh shit, I'm living my life in this direction. Is this the direction I want to be going in? Because that was how I felt before. Now I'm forced to go and do the work that I've kind of been avoiding.
Yeah.
And actually I'm starting to realize like, oh, actually living life like I was before isn't how I need to or have to live it. I can actually live it in a different way. So we've talked about this before, but maybe you can explain a bit more of how many of your patients would you say is kind of true to that sense of these events, whether it causes a concussion or some kind of spinal alignment or life alignment, is actually like a blessing in disguise for some of these people, where suddenly it takes on a whole new course of life.
I was going to say, it's as unfortunate as these injuries are, there's definitely that silver lining to it, in that they realized like, whoa, the life I was leading was actually very unsustainable. And so they make these shifts and these changes, both physically and emotionally, and it's pretty amazing. It's pretty cool to see. I've had quite a few patients actually, years out after treatment, reach out to me and be like, I am like a completely different person, but for the better. The work that you've done has really changed. It really opened my eyes to the kind of a more, I wouldn't say reasonable, but just a better way of living for them in particular.
You could specify, or what do you think the way of living was and moved to in some of those instances?
Yeah, so I have one person in particular that I'm thinking about. He was a CEO for his like a startup company, and he's just like super go-getter, very, very busy. And then he was also a really big triathlete. He was training he would do Ironman races, but he was also training for like an off-road Ironman. I think it was called an Xterra or something like that. But anyways, it was just like he was having to go for these like 6-hour training sessions, plus trying to be the CEO of this business, and just like spreading himself way too thin and just burning the candle at both ends. He unfortunately was riding his bike on a training ride, and he fell and he got a concussion, and he was just struggling. He was trying to keep that same pace of like training and work, and it just like he couldn't keep up with it. And so unfortunately, he ended up leaving that business, or he sold it, and then he just focused on the recovery aspect, and now he's a big concussion advocate now. And so he's very kind of like much more mellow, or seemingly mellow. I guess it would be like a little more normal now, because he was just like redlining the whole time.
Well, yeah, that seems to be a common thing in today's era of kind of I guess to do a degree materialistic, but kind of capitalist and kind of very much high performer, high achiever, want to be the best at everything and do all the things at the same time. And the nervous system feels that and takes this kind of what's called the allostatic load and starts to wear down. So I, have curiosities around. I always have curiosities with these kind of injuries of why was it that time that event happened? The other times you've fallen off your bike, you didn't get a concussion or you didn't break your arm, but this time it did happen.
Yeah, exactly.
And so there's that kind of weakening of the nervous system that's kind of is already in a kind of brittle, bracing state. And so then just kind of knocking it, and it just kind of cracks to a degree. And so for someone like that who's kind of come in, how have you seen, or how have you helped them kind of navigate that identity change as it starts to come up? Previously they were the Ironman, the CEO, and now they're recovering. And that's a big transition in the two different identities. And how have you seen that kind of play out within your clients or within this world?
Yeah, it's always really, really difficult for them, especially these type A go-getters. And I feel like it's very much this see this guy region as well. It's hard for them because they used to be this like I'm this multi-sport day kind of person, and now now they have to tone it back a little bit and do maybe just one sport a day. But I find it initially it's very, very difficult for them, and so that's where having that cognitive and emotional support is really important. A counselor, psychologist, that kind of stuff to work through any difficulties that they have around that, any mental blocks. Because that's the other thing is with this brain work, their mental state is really influencing their recovery as well. I've had lots of people who come in and they're, for the initial assessment and maybe the first couple treatments, they're very like hesitant or very guarded. They're not very open to anything, and that it's really slow going in the beginning until they kind of relax and let go and be open to this like an avenue of treatment, and then it starts to skyrocket in terms of their recovery. It just like exponentially grows that much faster. So having that like the right mindset is a big part of the recovery.
And so just on that mindset piece, two questions come up. One is what do you see as the turning point of that kind of closed to open? And two, what is the kind of nuanced difference there? Maybe I've said closed and open, but how would you see those things? Like, so what is the mindset shift and how does it get shifted?
Yeah, so I would say probably the most important one, or the one that comes up most often, having the injury becoming their identity. So that is one of the, but I guess what I'm trying to say is most people, they gauge their recovery or they gauge how well they're doing based on their symptoms. That's not, yes, it is an important thing to watch for, but it's not as important as what is my capacity to do things. Because that is what really shows the progress that you're making. So for example, symptoms, they come and go. They fluctuate up, down, in, out, front, back, depending on the moment and depending on the day, depending on everything. But your capacity to, let's say, I used to be able to read 5 minutes before I started to get this throbbing headache. Now I can read 20 minutes before this headache comes in. That's a huge improvement. And so just flipping that mindset, me just kind of like reminding them, your capacity is getting way, way better. Like, this is amazing. You're getting stronger. You can tolerate things. Yes, symptoms are still there. And yes, they will still be there for a little while. But symptoms are not a good gauge for your recovery. So I think that kind of like a mindset shift is where I see most people become more open to treatments and more open to recovery. The other thing is when you get into these more chronic cases, like there's one person in particular, she was 15 years out from her first concussion, and she had built this support network around her where people would like drop whatever they're doing and then come help whenever she needed. Which is amazing that she has that network, but then over time she becomes reliant on that, and if she's risking losing that if she gets better. And so that's always such a difficult case to navigate. And just like, I guess going back, that's why it's so important to have emotional, spiritual, psychological support in this recovery. Yeah, I think I answered that question.
Yeah, sounds like a reframe of like what the actual goal is from being symptoms into capacity is making progress rather than this, back to normal to a degree.
Yes.
And then this other piece around, I guess that potentiality of the change in circumstances actually becoming a new normal that means that you want to stay in that state of discomfort because of the benefits it gives you, and this kind of comfortable dysfunction occurs where you don't actually want to change even though you say you do, because you're getting all of this potential special treatment which might not be what you really want, but a part of you actually appreciates the safety of it, the connection of it, and there might be a fear around, well, if I'm healthy, will there people still come and be there for me?
Yes.
A deep one to navigate. And so within the neuroscience, the clinical aspect of it, how much of your work then is around this kind of the physicality of it versus the mental kind of conscious aspect of it? Yeah,
I try to sprinkle in some of that mental conscious work as much as I can. That is at least allowed within my scope. Being a chiropractor, it's here in BC at least, it's very limited in terms of what I can do, which is why I'm always referring out. It is this multidisciplinary approach. But I would say the vast majority of what I do is very physical. I do a lot of eye movements, I do a lot of vestibular rehab, I do adjustments and muscle work, and we do work in the gym, if it's lifting weights or moving particular ways, that kind of stuff. But I'm always just kind of like trying to give those little nuggets of like reframing their mindset around this one particular exercise, or reframing certain things, or trying to just drop these little things as opposed to sitting down and being like, okay, we're having like a counseling session today. Sometimes it ends up being that. Sometimes it ends up being that, it's a very challenging injury to be going through. Concussions is kind of like what I'm talking about, but really any neurological condition is very challenging to be going through, because it's not only affecting you, it's also affecting your family, your loved ones, your friends. And so it's really hard to just isolate it to this one person. It's going to be affecting many other people. And sometimes the patient recognizes that, and it takes a toll on them. Sometimes they just need to just release, and that's totally okay. It's a safe space. So we just ride that wave until it's just kind of like, okay, we're good. We're back here now.
Yeah, great. That's powerful that you can provide that space for them. And so just out of a kind of a curiosity of my own, is it, in terms of somebody having concussion, is obviously a kind of range of severity. What would you say is a kind of a typical time for kind of bringing capacities back to a normal level, or, reducing symptoms back to a kind of level that you can stand?
Yeah, that's a really good question. So it depends on a couple different factors, but literature right now is saying roughly 4 to 6 weeks is when symptoms will be gone and you are technically back into normal. What pretty much that they're looking at is when you get a concussion, you fall into what's called an energy deficit. So you get this concussion, you get this big spurt release of energy in the brain, and energy specifically being ATP, and you burn through all the stored ATP that you have, essentially, and then you drop down. So now you are roughly at about 20% lower available energy, and then you have to work your way out of that. And in order to restore that energy, you need to spend energy. So it kind of becomes, a lot of people do like one step forward, one step back, one step forward, one step back. But if you do things correctly from the get-go, nutrition, hydration, sleep, neurological assessment, and specific exercises to what you're doing, are setting yourself up for success in that you are doing like 2-3 steps forward and maybe 1 step back, 2-3 steps forward, 1 step back. So you get this upward trend of recovery. Mm-hmm. That's in kind of like the acute concussion. In terms of the chronic concussions, which is more of what I see, it really depends. There's many different factors that go into it. If you've heard of the biopsychosocial model, it's essentially taking into consideration their body, their mental state, and then their social state. So that means like essentially like, are they educated? Are they or not? Do they have enough income? Do they not? Are they living in a supported environment, or are they living in an abusive environment, or that kind of stuff? So many different factors go into the recovery. That biopsychosocial model is typically associated with pain. So if someone has chronic pain, you want to look more into the psychological and social aspect of their recovery, as opposed to just the purely like biomechanical, or like, well, let's just adjust your back always, or let's always IMS this one particular area.
Yeah, right. Makes a lot of sense. And using that kind of wrong analogy, what we said before, it's kind of taking a couple of steps up and then a couple of steps to the side, because you're getting some kind of neurological pathway that isn't quite back to normal. And so now you're creating a whole different loop that you might have to kind of work your way out of.
Exactly.
In order to get back to where you were before.
Yeah.
But curiosity around the ATP piece. So why is the brain using up that energy at that point in time, for protection or for something else?
So it comes down to neurophysiology. The way a nerve works, or a neuron, which is the brain cell, is there is an electrical potential from the outside to the inside. So that means there's a gradient. So on the outside, it's more positively charged, and on the inside, it's more negatively charged. And then it's held that way, and that requires energy to maintain this gradient, because normal homeostasis, you want to equal things out, and it's held in place by these channels, and that only open and close when that ATP is present, so that it can open and close. But with a concussion, it's actually physically stretching and opening those channels, so now this gradient can flip-flop and fall into that homeostasis without using that energy. Your body recognizes that and now is actively using that energy to try to restore that gradient. And that using energy is what I'm saying brings you into that energy deficit. It happens very, very quickly that you start to like burn through all that, because it's not just like one brain cell in particular. It's one of the trillions of brain cells that you have. That is essentially everything that just kind of gets like rattled and shaken up and sheared enough that these gates, they open, so now they can flip-flop, and they have to use that energy to restore that gradient.
And is that a kind of a driver for brain fog in that kind of work?
Very much. Yeah, brain fog is strongly associated with this kind of stuff.
Yeah, well, cool. Super interesting learning more about concussions and brain side of things, kind of transitioning a little bit more into a bit of your own personal world with all this knowledge and kind of these insights into the way the nervous system works. You've obviously got a young daughter now, and you've transitioned into being a father. I kind of am curious about how that transition has been for you, being able to have awareness of these extra senses and going into the challenges of navigating a young person in your life. I'm wondering if you can speak a little bit to that journey of maybe some of the trials and tribulations and things that have really helped you in that state, and if you have any things that come to mind.
So I think kind of like one of the biggest things is having the understanding of a developing brain. Obviously Nora, my daughter, she's she's developing right from the get-go, and seeing these things firsthand and kind of recognizing the neurology behind it is a really, to me, it's really, really cool. It's so amazing to see. And what's also really interesting is I can relate these things to my patients, in that some patients, they show up with these primitive reflexes that have suddenly come back again. And Nora, when she was much younger, she had these primitive reflexes. So I could test it, and I could see, wow, that's what it looks like. And I could remember back to a patient, oh, that's what that looked like too. It was a really cool experience. Just like having anyone going through a newborn into infant into toddler, they are obviously going to come across these challenges. And one thing that, and it can sometimes be very frustrating, and one thing I just have to remind myself of is she's still developing. She's still trying to understand. She's still trying to figure out her body, her brain, her emotions. And that's what we're there for, is we're there to help guide and regulate.
Yeah, there's a big piece, co-regulation, necessity of that in order for a child who doesn't know how to regulate themselves to calm down and to kind of be held in a space of love, even in these big emotions that kind of move through them. There's one thing that has been, and it blows me away every single time I see it, which is the ability of children to go through a range of emotion with zero residual, I'm going to call it like that. It's like full screams and then full laughter within 5 seconds. Yeah. And you're just like, what just happened there?
How did that?
So annoyed at that. And they're just like, nope, it's the thing of the past now, it's done.
Yeah.
And that for me is kind of a beautiful reminder as us as adults, because there's a lot of like holding on to things that have happened a long time after, and it's kind of your own, there's obviously an element of brain trying to learn from these situations, and it's kind of an internal choice of whether or not you continue to have that emotional response to it, or if you learn from the child, which is to fully express, release all that emotional fuel, and then come back down to this homeostasis point to allow you to then be more in the joy. And I wonder what the correlations are with that, of especially within concussions, I guess, of previously you had all the joys of being out there and pushing yourself to the limit and having the thrill and the adventure, and now you're in the recovery mode, and there's a kind of holding on to, I want things to be like that, and I'm still kind of resentful of the fact that I'm not able to be there, as kind of not creating a very fertile soil for you to be like, I am where I am, and I need to just make one step at a time to grow out into this new state. And so I wonder how much of what other things we can learn from children in this journey to recovery that we're kind of missing out on.
Yeah, totally. I guess one thing that I feel like is a nice reminder for me is Nora's really good at just appreciating the small things. So for example, we were just out for a walk this morning, and we have a neighbor who has a series of flower, or like little pots with flowers in them. And every time Nora walks by them, she has to stop and smell the flowers. And it's just like, oh yeah, that is really nice. You can just really enjoy things and use those senses to really gain so much more information and understanding of everything. It's really nice. Yeah. And she loves to just, she walks on the trail, and then she finds this really cool stick. So cool. And she holds it, and then she holds us and goes for a little walk, and just appreciating the small things. And I think that's kind of brings it back to the present moment. And so just like you said, us as adults, we're very good at holding on to the past, or holding on to grudges, essentially. And so it's a nice refresher.
And, I guess our brains are primed to be more alert to pain and to kind of things that are threatening than things that are joyful. But, not to spend the rest of the conversation talking about our children, but I was also amazed yesterday at Sophia, my daughter, who was just staring at her own hand and was just like marveling at it and just like moving it. And just, I kind of connected in with her and being like, oh wow, just like, I can control this thing. And it can move, and I can grab stuff with it. And it's just being able to have the kind of the Zen kind of beginner's mind attitude towards life, I feel like creates a very fertile soil for helping the body to regenerate in its natural way. And there's this other chiropractor I was doing some sessions with, and he was really talking about this, allowing your body to reorganize itself back into healing, and that idea of the reorganization of you've just kind of disorganized yourself. And so kind of helping your body to kind of come back into alignment so that it can just do what it naturally does. And how there's this kind of, as you said, the adult challenge of holding on to the issues of what I don't have rather than appreciating what I do have, and then kind of getting into these cycles feels like it can play a powerful role on the healing journey into the world. And final thing I'll say about my children, but my son also had this breathwork technique that my daughter also has. I don't know if you've seen it in Nora, but when he got very stimulated or when he's just down regulating, he does this little, basically like the physiological sigh, like he does this breath in and then a couple of breaths to kind of top up and then lets it go. And I just noticed a shift. Have you seen Nora do that?
I have, yeah. And it's funny you bringing that up. That's an exercise that I give to some of my patients as part of more of this vagus nerve exercise. Essentially, that's kind of how I describe it. And it's just bringing you a little further away from that fight or flight response, trying to ground you, trying to make you a little more present. Because we know that that is going to be the optimal, like you said, the optimal soil for recovery, for your body to really kind of grow and take those next steps. Is you need to be a little better at coming away from that fight or flight response.
Yeah, for sure. I have a curiosity right now, which is around how much of people's stiffness and immobility is actually kind of mentally caused versus actually physically caused. I don't know if you have any answers to that.
I think that's a really good question. I would say a lot of people's stiffness is more brain driven as opposed to physically restricted. So I've got like a number of different examples, but I think there's one patient in particular that I'm thinking of. She had a vestibular disorder, so an inner ear disorder. It wasn't this traditional way of being like super dizzy and unsteady. The way she presented was neck pain, chronic stiffness that also would transfer down into the rest of her spine, where she would foam roll for hours and hours and hours. And yeah, it would help at the time, but then an hour later it would just come right back. And she had done everything. She had done IMS, she'd done acupuncture, chiro, massage, craniosacral, all the things. And I looked at her vestibular system and we worked on that. And within like 2 or 3 visits, she was, holy, this is amazing. Like, what is going on? My neck range of motion is now much further. There's much less pain. And the way I described it was, your brain recognizes this movement as being unsafe, so it's going to avoid going into that. And so we gave it the capacity to feel that range of motion without that feeling of it being unsafe or threatening. And that's in my lens what a lot of stiffness is. Your body or your brain is trying to limit that motion because it feels unsafe in that range. And so you can take that either through like a more of a physical aspect with the vestibular system, or you can also take it through a little more of a cognitive emotional side. Because I've had many other patients who are very stiff and rigid because they have a higher sympathetic tone or much more tendency towards fight or flight, as opposed to more rest and digest.
Yeah, wow, that's really powerful. 2 kind of questions coming off that is, one, do you think that stiffness and coming to old age is a thing that can be avoided then with, adequate mental work, feeling safe, and also kind of the physical aspect of it as well? Maybe you can speak about that kind of coming into more active old age, because I've seen I did a heli skiing trip 10 years ago, and there was a 70-something-year-old man from Japan, and every year he went snowboarding on the heli skiing trip, and he was crushing it. He was going down like everybody else. And so I was just really curious about how some people are just able to be very active later on into their life, and some people just become a bit more frozen in their
Yeah, I often think what is kind of like the elixir of life. To put it simply, I would say movement. If you can move regularly, I think that's going to go so long, or it's going to go a long way in your longevity, essentially. And that includes like movement, as in like some yoga, or it can be walking, but more like weightlifting or resistance training, cardiovascular training as well. It's very, very powerful. There's also something to be said that when you are exercising, you you feel better. You just tend to feel a lot better after you've been exercising. And that plays into more of this mental, emotional side of things, where you are just overall a much more happier person. Right? You've got more capacity for these emotional fluctuations, more tolerance to it. What I find, people who don't have that tolerance typically become much more just like tense and stressed, and because they're not really sure how to navigate that.
And so if we're using the example of the vestibular imbalance and trying to create more safety in movement, what are some of the ways that you would go about that, or you could suggest somebody to start to increase that kind of window of tolerance or that level of safety in their movements?
Yeah. So it needs to be some specific eye movements and head motions based on their specific neurology, but a really nice general place to start is something called gaze stability. So that's where you are. Let's see if I can do this here. So I'm looking at my thumb, and I'm keeping my eyes on my thumb, and I'm turning my head side to side like this. And you're only going up to, if you have like neck pain or stiffness, you're only going up to that part where you feel like, okay, this is now starting to be like painful or uncomfortable. And you groove that, do 10 repetitions, and then you come back and you go up and down, like you're nodding your head yes. Same kind of thing. You go up to where it's a little uncomfortable, and then you go down to where it's a little uncomfortable. You just do that 10 reps. Do that like multiple times throughout the day, because that takes 30 seconds. It should be a relatively easy way to introduce a little more vestibular work specifically.
Can you explain the science behind the thumb or the holding eye position versus the head movement?
Yeah. So there's something called a vestibulo-ocular reflex. So that's a vestibulo-ocular reflex, where if your head turns 10 degrees to the right, your eyes go 10 degrees to the left. That allows you to move your head around in space, but still keep your eyes fixated on a target. This movement here, where you're staying fixated, it doesn't have to be your thumb, it can be something in the distance, but staying fixated on the target and then turning your head taps into that reflex. Most people with a vestibular disorder, the reason they feel motion sick or they feel dizzy or they feel headachy or eye strain is because their eyes can't keep up with that motion. And so then you start recruiting your actual eye muscles or your neck muscles to influence how your eyes move. And that mismatch of information, your brain's now like, holy hell, what's going on? This is crazy. And then you start feeling symptoms. So that's kind of like the specific science behind why the gaze stability is important.
Nice, interesting. Yeah, I guess it kind of explains of the feeling car sick and looking to the horizon as well. So it's kind of then more stability in your eyes rather than something close up where it's just very unstable with all the movements.
Yeah.
Nice. Well, that's a good one to practice. And would you say any of those kind of exercises is useful for someone who's healthy to try to do, or do you think it just happens naturally as you just go about your day?
Totally. It definitely happens naturally, and I do think it's something that's important to do for anyone that's healthy. It's the same concept as maintaining your cardiovascular capacity or your strength. You're healthy, you may not have any pain or discomfort, but you can always make yourself a little better. And that's where I feel like this comes in.
Yeah, interesting. Because I have a lot of exercises with clients to work on interoception, doing body scans and connecting in with what's going on internally, and proprioception and becoming aware of the space around them. But the vestibular piece I haven't really kind of engaged that much with. So it's kind of a curious other angle to be exploring to really start to kind of tune that sense as well, because it is so important of a daily life. I know that my mum, for one, had a lot of dizziness. I think it was linked to her thyroid. And I don't know what the link is with the thyroid and dizziness. I don't know the science behind that either, but maybe you do know.
Yeah, there's a little more of a complex connection, but it's essentially the thyroid that's not producing adequate amounts of its hormones, and that those fluctuations are affecting centrally some vestibular components.
Right, okay. Obviously, it's a very complex system, so there's lots of layers to it. And yeah, as we kind of just start to go towards the hour here, I have one kind of curiosity. Complete side note, your wife is also a doctor, she's also a chiropractor. Do you guys nerd out all the time on chiropractic world, or do you?
Yes. Yeah, it's really funny. It's wonderful. We talk about different, like I'll come home and be like, man, I had this difficult patient today, like or it was just a challenging case for me, and I'd tell her about it, and she'd be like, oh, just try this, and I'd be like, oh, of course, that's great. And then, going back to our daughter, we nerd out a lot about her. Because we both know like the developmental phases and the milestones, and so she's got her chiropractic perspective, I've got my chiropractic perspective on things, and it's a really cool experience to see. And yeah, we definitely talk a lot about the brain.
Do your differing approaches ever clash within some worlds? Or
no, it's really nice. Like so, Alyssa, she's very much a nervous system chiropractor as well, and she's very intuitive. She's very good at just kind of like feeling into it, and she just knows this is going to work, or this is how it works. Where I'm a little more kind of like literal, and I feel like I need to understand the mechanism in order to understand it, and we can both explain each other's findings with our own perspectives. Yeah, it's really cool.
Nice, that's cool. There was someone saying that long-term relationships are best when they have this mutual outside project that's not a child and it's not themselves, but is something that you align on that's outside of you both. So having a common interest as deep as the nervous system and chiropractic and neurology is obviously a passion that you can both speak for hours on and come together on and explore. So that's awesome to hear that.
Yeah.
And so in light of that, I've got two more questions. Mm-hmm. One is this curiosity that I ask everybody is, what does a rich life mean to you?
Yeah, that's a really good question. And I've been kind of like thinking about this, and I feel like, to put it concisely, I feel like a rich life is a life that you lead where you feel satisfied with everything that you're doing, and you're not putting up a front, or you're not putting up this mask. You are exactly who you are, and what you're doing is exactly what it's supposed to be. Mm-hmm. I feel like that's kind of like I feel like that's the best way I can put words to it.
Nice. So satisfaction, and to a degree a level of authenticity and integrity.
Yes. Yeah. That's much better than mine.
Yeah, powerful values to be living into. And the final one, which is I like to end with the big but also the small question, which is, if you were to be only remembered for this one sentence or this one thing that you wanted to kind of outlast you as kind of your legacy, what would you want to pass on to the world?
That's really hard. It's a very broad question, but a very specific question. I would say maybe I would say like things will change. Things will change. Like it's not a permanent position that you're in right now. I guess I say that coming from the perspective of seeing a lot of people who are in this chronic recovery, and that they feel like they're always stagnant. But it will change. I think that's nice. a fair thing to share.
Yeah, beautiful. There was a quote that comes to mind, which is, the only constant in life is that life will change.
Yes.
Or that life is unconstant, I guess that's probably a way of putting it. But
yeah.
Beautiful. Well, that's a powerful line to be sharing with the world. So thank you for that, and thank you for your time. If anybody wants to learn more about you or to come and have a session, what's the best way of learning about you?
Yeah, so I am currently in Squamish, and I work at Fall Line Fitness, and there's falllinefit.com. And my email, you can always reach out to me. I'm happy to answer emails. My email is drstridsland@gmail.com, stridsland@gmail.com. I am on Instagram, however, I'm not very active at all, so don't expect any crazy content coming up, but I do check messages and that kind of stuff. And again, same, Dr. Stridsland is my name there.
No, perfect. Well, thank you again, Andreas, and it's been a pleasure to explore these topics with you and to hear some of your wisdom.
Yeah, thanks for having me. I really enjoyed this. This was really nice.
Nice. Great, cool, perfect.